Good morning. My name is Emily. I'm one of the registered nurses here at the clinic. May I start by asking your name and date of birth, please?
Yeah, I'm Maria Damian, and my date of birth is November 18, 1989.
Perfect. That's exactly what I have here. Excellent. So how may I address you? For example, my personal pronouns are she, her, and you can address me with Emily.
You can call me Maria. I'm also she, her.
Excellent. Okay. So I understand that you're here today to get a pelvic examination, including your pap test and STBBI screens.
Yeah.
Have you had one before?
I have. It's been about 3 years since the last one.
Perfect. So we'll be redoing the whole examination and the pap test and the STBBI. Perfect. Before we begin, I'd just like to ask you some questions about your health history. Is that all right with you? Excellent. Okay, so now that we have gone through your health history, I just want to explain a little bit more about the pelvic examination that we'll be doing today. So it is an important part of your health for us to perform this examination to make sure that we can detect things early. So those could be like cell changes or even things like pain or changes in your discharge. And so we ask you lots of questions and then we perform an examination to make sure that we are supporting you in your health, okay? So I understand that this can be a sensitive topic and it can be, it feel very vulnerable or uncomfortable for some people. So I just want to make sure that you understand that your comfort is my priority during this examination. So if there's anything that I can do differently or changed for you to be more comfortable, please don't hesitate to let me know.
Okay. There's nothing I can think of right now.
Okay, perfect. So it's also crucial for us to discuss how comfortable you are with this assessment. So you said you had it 3 years ago. Have you had any experiences in your past that would make it difficult for you to go through the examination today? Is there anything you'd like to share with me?
Not that I can think of.
Okay, wonderful. Other things that I want to bring up are the concept of informed consent and your right to refuse. Okay, so informed consent means that I will be explaining everything as I go along and I will try to be as clear and as thorough as possible, but you have the right to stop me and ask me questions at any point. So I want you to fully understand what is going on, and that consent can be revoked at any time. Okay?
Okay.
The other thing is the right to refuse, which is exactly what it says, is that at any point you can refuse to answer one of my questions or any part of the examination. Okay? Even if we start something and you change your mind, you need to pause, take a break, or you want to stop, do not hesitate.
Okay.
All right? Okay. So next steps, I would like to explain the whole process for the examination today. So the first thing that I will do is leave the space and give you some privacy for you to undress from the waist down. So I see that you're wearing a dress. You can just hike up your dress if that makes you feel more comfortable.
Okay.
I will be providing you with a gown and a blanket. So you can use the gown if you prefer, and then you can cover your legs with the blanket.
Okay.
All right? So the next steps will be for me to move on to the inspection. So when you're ready, you will call me back into the room and I will join you in the space and I will sit at the end of the examination table. Once you are sitting comfortably and you're comfortable in the position, I will move on to the inspection. So what that entails is me just observing the areas of your body that are usually covered with your undergarments. So I'll be inspecting all your genitals as well as your rectal area. And then once that's done, we'll move on to the bimanual examination. So what that entails is me actually palpating the outside of your vulva and your genitals. And then once we are ready for that, I will insert lubricated gloved fingers inside your vagina to make sure that I can assess your uterus and your cervix. Are we okay so far?
Yep.
Any questions?
No.
Okay, perfect. So after that, we'll move on to the speculum examination. So you've had a speculum examination before.
Yeah, it's that.
Yes, okay, the one that looks like the little duck. So what we'll do is I will use the speculum to make sure that I visually inspect now the inside of your vagina and your cervix, and that will then allow me to perform the pap test and get the STBBI swabs that I need. All right?
Okay.
Okay. Do you understand everything that I've explained so far?
Yeah, makes sense.
Okay. Do you have any questions for me?
No.
Okay.
Not that I can think of.
All right. Are you comfortable with me carrying out the examination?
That's fine. It's a little cold in here. Can I have an extra blanket maybe?
Of course, I can bring
Okay.
one in when I come back.
Perfect.
Okay, excellent. So we've reviewed your past medical history. I have your chart here. And before I leave to let you dress, is there anyone that you would like to accompany you to step in while you for the exam?
No.
No. And would you like me to call in a female member of staff or a chaperone during the examination?
No.
You're all right with that?
Yep.
Perfect. Okay, so I will exit, draw the curtain, and you just call me in when you're ready.
Okay,
Okay,
perfect.
perfect.